Both prostaglandins and thromboxins, their synthesis, their degradation, and the different pathways which are based upon these compounds, they have some clinical relevance also, because many of the drugs which act upon these compounds or act upon the enzymes which are involved in the metabolism of these compounds, and as a result of this, these compounds are of very really some important clinical, they really have some clinical importance. First of all, there are the compounds which are inhibited by the cortisol. You know, cortisol is a steroid hormone, and it is involved in the activation and inhibition of different types of eicosanoids. Cortisol inhibits the, for instance, it inhibits the phospholipase activity. As a result of this phospholipase activity, the phospholipid is not cleaved, and as a result, it's not released from the cell membrane. So, you know that arachidonic acids and the derivatives of arachidonic acids are also then bound with the phospholipids in the membrane, then it is also not released. So, similarly, then there are the NSAIDs, that is non-steroid anti-inflammatory drugs like aspirin, indomethacin. They inhibit the enzymes which we have been seeing, the enzymes which are involved in this metabolism of PGS and TXs like COX-1 and COX-2. Because of this inhibition of these enzymes, what will happen? That the inflammatory responses which are caused by the prostaglandins and thromboxane, they are also reduced. So, that's why we use these drugs to reduce or minimize inflammation. Aspirin also performs its function by inducing the synthesis of lipoxins, resolvins, and protectins. These are other type of eicosanoids which are involved in it. Then there are COX-2 specific inhibitors also, which maintains the functioning of the COX-1 by inhibiting the COX-2. So, in this way, it can happen that inhibition of one enzyme can activate or synergize the function of another enzyme, even if it's an isoenzyme of that enzyme. But there is side effects also of using these inhibitors like celecoxib. When we use celecoxib, it leads to the heart diseases, or it may lead to heart attack also. Likewise, thromboxines are produced by the COX-1 in the platelets. As I have already told you, that COX-1 is tissue specific enzyme, in contrast to COX-2, which is constitutively produced in almost all the tissues or most of the tissues. And in this way, this activation leads to the adhesion and aggregation. You know that platelets, one of the major function of platelets is the aggregation of the proteins, which one of the manifestation of which is the blood clotting. Then PG12, which is produced by the COX-2 in the endothelial cells, it on the other hand inhibits the platelet aggregation. So, and we have been seeing it again and again, in certain circumstances, one eicosanoid or one type of eicosanoid will synergize the another eicosanoid. On the other hand, one eicosanoid then inhibit the action of the another eicosanoid. It can also happen. The PG12 also leads to vasodilation, and it impairs the thrombogenesis. This is how it acts as it cancels the effect of the thromboxanes. Then we have been seeing it again and again, that aspirins are implicated in many of the eicosanoids. One of the way of doing this is that they inhibit the TXA2 synthesis by COX-1 in the platelets, and in this way they reduce the effect of the inflammation. So many of the problems you feel, commonly occurring problems like the heart pain or headache or pain in your muscles, they are relieved or they're reduced by using these over-the-counter drugs, because these over-the-counter drugs, they act upon the metabolism of these small molecules, these eicosanoids. But at the same time, also keep in mind, which we have seen, that these drugs are also implicated in inflammatory responses, which can lead to allergic reactions. So one have to keep in mind that on one hand, these drugs, over-the-counter drugs, can be useful, but sometimes they can also initiate allergic reactions.